Samir Nayyar. So Dr. Samir Nayyar, he is one of the few functional dentists in India. It's also called biological dentistry. And he practices in Jalandhar, Punjab. So it's not just the oral cavity that he's focused on. He also has expertise in ozone therapy, and he uses ozone therapy for reversing diabetes in people. So, and he strongly believes in balancing the oral microbiome with the rest of the body. And we'll get to know a lot about various connections today. He'll be speaking about mercury fillings, how damaging they can be, and how important it is to get rid of them, and the right way to do it safely so that you don't add up to the troubles in the body in the process of removing the mercury fillings. So a very warm welcome, Dr. Samir. Thank you for being with us today.
Thank you, ma'am. Thank you.
And over to you. You can share your screen.
Yeah. Is it visible now, ma'am?
Yes, yes.
Thank you. So I am Dr. Samir Nayyar, and I am from Jalandhar, Punjab, and I help people to smile better. So I am practicing dentistry since 2007, and I am blessed to be a part of this conference amongst the most esteemed personalities who means the names are just enough to speak. And I feel this is a great initiative taken by IAFM also, and by this we can way we can reach out to more and more people and educate them. So I would thank Dr. Preeti Nanda and other team members for inviting me here and giving me an opportunity to share my skills and my views. And basically, I think as a mercury-free and mercury-safe holistic dentist, I believe it's my responsibility to share my views on the topic poison in your teeth. I think, yes, you heard it right. The poison in your teeth, that means the mercury fillings. One of my the today's major topic of concern, which has been neglected since many decades. So before starting my presentation, I just want to know how many of you have silver fillings in your mouth, because this presentation is going to change your thinking about silver fillings. And if your answer is yes, then you must stick to my presentation till the end. So during the initial years of my practice, even I used this controversial dental restorative material, and because I was unaware of this, the consequences and the concept of functional dentistry was not that much prominent over then. But being inquisitive, I started discovering the relation between the oral cavity and the oral health. And this is how I shifted my approach from conventional dentistry to the functional dentistry. So, is my screen, ma'am, fully visible?
Yes, sir. Right now we can, yeah, it's gone to another slide. Toxic.
Okay, thank you. So basically, then I shifted my practice from functional dentistry to from conventional dentistry to the functional dentistry. And when you think of amalgam, you must think of mercury, because 50% of your mercury, your amalgam filling is basically your amalgam only. So this is the most poisonous and non-radioactive naturally occurring substance in the planet. And my presentation won't make any sense if you don't understand some basic concepts. I think there is some disturbance over my network. No problem. Okay, so there is no safe or harmless level of mercury. Just one atom of mercury is enough. Is really poisonous to our body. So amalgam fillings, they continuously release mercury vapors, and there are three forms of mercury basically of the elemental mercury, and which release mercury fillings, amalgam fillings, they contain the elemental mercury, and they continuously release the poisonous mercury vapors. So mercury is a non-toxic and bioaccumulative substance. It often finds its way into the body through the dental amalgams, which is used to restore our teeth. These silver fillings, they also come as amalgam fillings because they composed of 50% elemental mercury and 50% of other metals. Dentists all over the world, they just use amalgam as the restorative material, but the mercury found in amalgam fillings has raised some concerns. Amalgam can release small amounts of mercury vapors over time, and the patient can absorb these vapors by inhaling and ingesting them. During the procedure, like the patient is going for the filling or either even for the removal of the amalgam filling, with the high-speed dental burr, it generates a cloud of particles, and at least 65% of them, they are less than 1 micron in size, and doctor can inhale these particles. And see, this is very disheartening, because I told you that on stimulation, amalgam fillings, they release mercury vapors, and it can be any form of stimulation, like the basic routine procedures, your brushing technique, your chewing whenever you eating or drinking hot beverages, teeth grinding, which is very common nowadays. Mercury vapors are being released continuously. So in short, we can say that the amount of mercury vapors they are released is directly proportional to the heat generated, amount of temperature in our mouth, and the heat being generated by various actions. But that doesn't mean that you must stop doing these things like brushing your teeth and eating something like that. But we must get rid of the mercury fillings. So heat is the key. We can say that more is the heat, more will be the mercury vapors. We can see that while chewing food and eating sweets, we release one mercury filling will release around 68 to 70 micrograms. While brushing your teeth, one amalgam filling can release 270 to 300 micrograms, depending upon the type of brush you are using. While your dentist is doing the procedure, it can generate 500 to 600 microgram of mercury vapors. One average mercury filling, amalgam filling, it contains 1 gram of mercury, and 1 gram of mercury is available in the thermometer as well, and which is enough to contaminate a 20-acre lake to the point where warnings not to eat any fish caught would be issued. So the question arises, how much is too much? We may see that numbers like 36, 68, 72, 272 may not seem like much, but how do the numbers 12 trillion, 80 trillion, 1000 trillion sound to you? So when you recall that every atom of mercury that accumulates in our body will harm it in some way or the other, those numbers like trillions, they can never be considered too small not to worry about. So there are actually more atoms of mercury in just 30 micrograms than there are in cells in our human body. So let's do some maths here. Suppose your mercury filling is releasing 10 microgram of mercury vapors, and 80% of the mercury vapors are being inhaled by the patient. So if 10 microgram is a number, the body will absorb 8 microgram of mercury. So you can see that 1 microgram of mercury vapor, it contains 3 trillion of atoms, mercury atoms. So when we multiply this 8 microgram into 3, that becomes 24 trillion atoms. I think this is a number we must think about. So I have told you that there is no safe or harmless level of mercury. So while you are brushing your teeth, you are generating 816 trillion atoms. So you can imagine what these 816 trillion atoms can do to your body. So you brush twice a day and you generate twice the number of atoms, mercury atoms. So it depends upon the vapors, means what is the type of the amalgam, is it high or low copper content, the number of fillings, the size of the fillings, how long they have been in your teeth, how and how often they are stimulated, how long the stimulation lasts. So Dr. Tom Mercury demonstration proves that the very high levels of mercury vapors are released by brushing a silver filling. So he just demonstrated with the Jerome's testing device. While reading the normal air, he just found that only there is no mercury level in the air. So it will show 0 mercury level. You can see that. This is the air sample. So then he took amalgam filling with 3 surface amalgam fillings. This is a pre-stimulation. He will touch the surface of the amalgam filling. Now you can see how many how much mercury this amalgam filling is releasing. This is 6 micrograms. So when we multiply it with 3, it becomes 18 trillion atoms. So now he is stimulating the amalgam filling with a soft bristle toothbrush. We'll do it for 3 seconds. Oh, sorry, 10 seconds. Now it depends upon what type of filling it is having. So this is generating 260 micrograms of mercury per cubic meter of air. Now this can even increase when you are brushing hard or you are brushing for a longer time. So next is the galvanic currents. If both amalgam fillings and gold crowns are present in your mouth at the same time, a galvanic current is generated. So being two distinct metals, the current will be similar to what happens in your car battery. So this current causes a continuous release of mercury even when the amalgam fillings are not stimulated. Even if the fillings are not heated, even then you would be exposed to the mercury vapors for whole of the day. So now on stimulation, mercury vapors are released from the dental amalgam after inhalation, and via lungs up to 80% of it gets absorbed. Rest 20% of it gets exhaled. Mercury that it gets distributed throughout the body. So, but major part of it gets accumulated in your various systems like nervous system, your liver, kidney, and so on. So till now we found that only one atom is harmful. Now the next question comes: what mercury atoms do in our body? So mercury atoms, they do a damage at a cellular level. The elemental mercury, it is highly fat soluble. So this characteristics allows it to pass through the membrane of every cell in the body, including the brain. So it affects the amino acids as well. See, every basic component of cell, it is made up of proteins and amino acids, and they are the building blocks of our proteins. Mercury has affinity for the thiol group of amino acids like methionine, cysteine, and these are the major components of a molecule known as glutathione. And glutathione, I think this is the most important component of the body's body, and it is the best mercury chelator. And basically glutathione, it just pulls the mercury from the that is attached in the proteins and enzymes, and it carries into the liver and out through the bile duct into the intestine and out of the body via feces. So it takes two molecules of glutathione to effectively transport one atom of mercury from the body. So you can see that our body can remove the mercury atoms as long as it is able to. The body will remove millions of atoms of mercury daily, but the bad news is the process of removing can create serious deficiency in glutathione, which has important functions such as your energy production, neutralizing free radicals, and so on. So it affects the proteins as well, and the amino acids are the building blocks of the proteins. And if anything happens to the amino acids, then it definitely affects the protein structure and its functioning. See, most of the components found in the cell are made up of proteins such as your enzymes, antioxidants, hormones, DNA. And if anything happens to them, you can imagine your body's reaction to that. So you might have heard of the hormone insulin, and if it does not work properly, then it can lead to diabetes. So mercury damages proteins because it displaces essential minerals that are normally attached to the thiol groups, such as your zinc, copper, magnesium, iron, iodine, and anything like that. So when mercury it replaces minerals and binds to these sites, it alters a protein's normal function. Similarly, it will affect your enzymes, and enzymes can no longer work properly. So continuous exposure to the mercury, it has an indirect effect by generating enormous amounts of free radicals. So these free radicals are highly reactive, and they can penetrate your cells and can cause cellular damage, making them a contributor to your degenerative diseases like heart disease, autoimmune diseases, and many diseases. We will come to these slides. So free radicals, they are produced during the normal process of cellular metabolism, but the body has enough antioxidants available, particularly your glutathione, alpha lipoic acid, vitamin C, vitamin E, selenium, flavonoids, and they just neutralize these free radicals. But if the production of free radicals is reduced, or the free radicals is excessive, or the antioxidant levels are low because of this mercury vapor, they means two glutathione molecules are required to neutralize this mercury atoms. So then cellular damage can occur. You can see that there are these are the few symptoms that can be in your oral cavity, like bleeding gums, metallic taste, burning sensation, amalgam tattoos, stomatitis, loosening of your teeth, ulcerations, alveolar bone loss. So these are the effects, indirect effects of the mercury on the body. Like it can affect your digestive system, it can cause constipation, loss of appetite, vomiting. It can hamper your emotions like anger, aggressiveness, fear, lethargy, mood swings, and the list goes on, like memory loss, allergies, immune deficiencies, high blood pressure and heart problems, fatigue, balance problems, mental confusion, digestive problems, joint stiffnesses. It can cause chronic fatigue, it can cause headaches, ringing in the ears, chest pain, then asthma, then your shallow respiration, shortness of breath, joint aches, muscle stiffness. The list goes on. These are the indirect effects over that. So it can cause sinusitis, stuffy nose, memory loss, allergies, and etc. Means list is very long. So these heavy metals and mercury in particular, they affect the functioning of the central nervous system and are extensively documented and associated with autism as well. So in 2020, the CDC reported that approximately 1 in every 54 children in the US, they are being diagnosed with autism spectrum disorder, and I think by 2022 the number has raised a lot. So next comes the how to get rid of it. We have got to know that it's really very harmful for our body, but how to get rid of it? So people don't realize that amalgam fillings are harmful to their health. Most don't even know that 50% of their amalgam fillings, they contain mercury, and still more people don't know that amalgam filling gives off toxic mercury vapor. And the fraction who do know don't realize how much vapor these fillings release when removed without a safe protocol. And the guidelines that I'm going to talk about for safe amalgam filling removal have been taken from several sources, and this preventive approach is important to minimize the mercury vapors exposure to the patient as well as to the dentist and his staff. So it's an absolute must for those who are pregnant, who suspect or know they are allergic to mercury, whoever had side effects during or after the amalgam fillings, those who have a compromised immune system, because we already have seen that numerous allergies and other serious health problems. So the protocol, it begins with the rubber dam sheet, placement of the rubber dam, as it isolates that tooth from the oral cavity and makes it easier to evacuate the filling material. It also prevents amalgam particles or the mercury vapors from being swallowed, and that's why I insist its usage while removing the amalgam fillings. Secondly, as we know that the heat is the key. The amount of mercury vapors being released from the amalgam filling, it is directly proportional to the heat. So cooling the filling by using as much as water. I use chilled ozonated, freshly ozonated chilled distilled water for my dental procedures. So thirdly, the usage of high power suctions. I use two suction systems, one for the internal mouth and one for aerosols. Basically, these high power suctions, they just intercepts the vapors before you can breathe it in. So next that we need to know is chunking the amalgams. We don't just grind whole of the amalgam filling, we try to chunk it out, take the piece, maximum biggest piece possible. Further, we use alternative source of air, that is oxygen, with your nasal cannula, so that the patient may not breathe the mercury vapors accidentally. So let's watch how I use this protocol in my clinical practice. But before that, I would like to show you that by using the principles of atomic absorption, the mercury vapors, they are visualized during the removal of a dental filling. And this is without using the protocols. You can see how many vapors are being released with the air rotor handpiece. So I start with the ozone therapy. I try to give it 15 days before the amalgam removal process. Then I give ozonated water rinsing twice a day. I give ozonated oils for massaging the gums. I give ozonated saline drips. Rectal ozone can be given to for the excretion system, and breathing through the ozonated oil, ozone minor auto hemotherapy for your basically immunity boosting, chilled ozonated distilled water I use in every procedure in my dental practice. What means C infusions can be given for antioxidant defense system. Glutathione, I think glutathione is the biggest name now. It's a queen of detoxifiers and the most important intracellular antioxidant for our system. So basically, it regulates other antioxidants as well. And Dr. Preeti Nanda, I think she is the best one. I always take advice from her for to handle the patients for my mercury removal. Chelation, next comes chelation therapy. It has been used for a long time as a treatment for mercury and lead poisoning. Uh, it's a clinical medical procedure that involves administration of a chelating agent to remove the heavy metals from the body. And I would say that it has to be done very carefully under medical supervision. Dr. Sibia from Ludhiana is the best one when we need to go for chelation therapy for our patients. So this is me. I start how I do my procedure. I give alternative source of breathing oxygen. A rubber dam is applied. Double suction is being given. Enough cool, fully chilled ozonated water is being used for cooling the filling. So you can see I use high power suctions for both the in both the things. Now the this biggest metal chunk is being taken out. I don't drill the complete silver filling. I think you have got this now, that how I do the procedure and how we must use the protocols we use in our clinic. So there is some evidence also that shows that activated charcoal taken 10 to 15 minutes before the removal of amalgam filling, they can capture accidentally swallowed elemental mercury or the mercury vapors, and allowing them to be harmlessly passed out of the intestine. So things needed to be done are: choose your dentist wisely, whether he is following these protocols or not. Replace the mercury fillings with the bioactive restorative materials or the composites or something which can be better than your mercury fillings. So in this video, it will be a demonstration on how we should restore the cavitated tooth. We are just cleaning the tooth properly. A proper restorative material is being used, and uh, has to be the latest one in the market. Just adapting and then curing it with a light source. It's a blue light source that helps to just help the filling to set faster. So we might have heard of three magical words: health is wealth. However, this pandemic has made all of us realize that health is the only true wealth. So make health an investment, not an expense. So I, with Dr. Priyanka Mohan, she is my colleague, and we started journey towards functional dentistry at Samir Dental Care. And I serve my dental patients at Samir Dental Care in Jalandhar, and and in my other clinic, that is OxyHeal. And there for diabetes reversal, you may visit there. Even for other metabolic disorders, this is also in Jalandhar. Thank you for being here today. I really appreciate that you took time to be here and listen to my presentation.
Thank you so much, Dr. Samir.
Thank
This
you.
was a very informative session. In our practice, many times people reach out to us asking for how to now get rid. You've told us, mercury fillings are bad, but now what do we do about it? Now we know where to send them so that they can safely get rid of this toxic element. So thank you so much. We do have some questions in the Q&A, and I will ask. What are the options or alternatives which are safe in place of the mercury filling?
So you see, composite fillings are available everywhere. You can go with the composite fillings, or for short term, you can go for GIC fillings. But right now, the market has flooded with bioactive restorative materials as well. They are the best one because they are just according to your oral cavity's temperature.
Okay. And so there's a question, are tooth caps dangerous?
You see, if properly done, we basically use metal-free restorations, or crowns, like we can use zirconia or Emax materials. For that, we should go for high-ended digital systems where there will be no marginal leakage or minimal marginal leakage. So minimal will be the marginal leakage. It will be the most safest thing, because if there are the crowns will with ill-fitting margins, they can be a reservoir for bacteria to grow over there.
Right.
Yeah.
And what's your take on RCTs?
Ha. So, very truly speaking, I don't do RCTs now. Means, I think I stopped doing root canals from 2016 only, when I studied all this subject in details. I just do pulpotomy. I just seal the nerves. I don't just take them out and give a biggest reservoir for the bacteria to grow inside, because whatever we can do, we cannot just completely fill the root canals properly with any material. So better to avoid root canals. If in case you require root canals, better to go with the latest systems only, not with the regular systems.
Okay, so what you suggest is, as pulpectomy, is that a good alternative to, rather going for RCT?
According to my personal experience, I think our first line of action should be the pulpotomy.
Okay.
If it fails, then we should think about anything else. But first, we should learn about pulpotomy, and we should definitely go for pulpotomy.
Okay. And so again, we know fluorides are not good. So I mean, what's your suggestion for the audience here?
Basically, it depends upon the environment you are living, the type of food you are eating, the type of water you are drinking, how much fluoride is there in that water. That all depends upon that, how much fluoride you can take in your toothpaste. But it's better nowadays. I recommend in my area. I don't recommend fluoride toothpaste to my patients.
Okay, and we do have safe alternatives available in India.
Yes. Means there are many available alternatives in that. You can even make your homemade toothpaste as well. So if you want, I can share with the method I do for my patients as well.
Please
I'll
do
share with you.
and you can share it here. We still have a minute. Or
Actually, I don't have the details of that slide. I haven't made that slide, so it will be half thing if I'll say like that.
yeah. So so the audience, we will get the recipe from Dr. Samir
Yeah, definitely.
conference. I'll take one more question.
Just one thing I would like to say: if the people who are using your regular toothpaste, just don't take medicated toothpaste if they are not required, and use a very little amount of toothpaste in that. Very little amount. You don't need to fill your brush with the toothpaste. Just touch it with your toothpaste. That is all what is required. And I give ozonated gum paints for my patients. I make myself. They add just 1 or 2 drops over the brush while brushing their teeth.
Wonderful. So one last question. So we have Sivaram saying that, it seems, many dentists who are practicing just the routine dentistry, they're not themselves aware of, the damage that may be causing to their patients in their practice. So
Yes.
how, where can these dentists refer to for right information?
They have to move out of the box. You can't just think everything will be pampered over them. You have to move out of the box. You can't, because these things are not being taught in our regular colleges and universities. You have to work You have to step out of your comfort zone and try to learn many things from many people are doing a lot of good work in our world now. Even in India, many practitioners are following these guidelines now.
Yes, yeah. So thank you so much, Dr. Samir. It was really very, very useful information that you have shared with us. Thank
Thank
you
you,
so
ma'am.
much.
Thank you.